Hi, welcome. Thanks for being here. Today, I want to talk to you about the lie that your doctors are telling you about neuropathy. Many doctors see patients for problems related to nerve damage or neuropathy, and these people are having numbness, tingling, burning pain, muscle cramping, muscle weakness, cold feet, and progressive balance issues. And one of the lies that they tell people all the time is that there's nothing that could be done for the problem. And what they really should be telling you is that there's nothing that they can do for the problem. That doesn't mean that there's nothing that can be done, or there's nothing that other people could be done. So, when it comes to neuropathy, there's a couple of different things that we need to do to keep the nerves functioning and moving correctly. The first is you got to make sure that you have proper circulation. One of the ways that we measure this is by checking the temperature of the skin and the legs and in the feet. As you know, the blood warms in the core and then it gets pumped onto the legs and the arms. And so what we want to do is make sure that the skin temperature of the feet and the legs is nice and warm. If you have a circulation problem, the blood can't flow pretty well, and as a result, it's going to turn cold. And so we use a thermometer to measure the temperature of the skin. If the temperature is the normal range, then the skin on the infrared camera turns pink. And if it's not that, it's got a problem. So the first thing that happens is that it turns yellow on the camera, then it turns green, and then it turns blue, and then it turns dark blue. So as your problem progresses and gets worse and worse and worse over time, your skin is going to start to get colder and colder and colder. I've done a lot of neuropathy exams, and I found that people that have, say, peripheral vascular disease, or they're a smoker, or they're a diabetic, they can't pump blood into their extremities as often as they should. And as a result, they have a condition called hypoxia, which means low oxygen level. And that causes damage to the nerves, causing some of the symptoms of neuropathy, including burning pain, numbness and tingling and muscle cramps, etc. The second thing that has to happen is that we have to evaluate the function of the nerves. And we want to make sure that the sensory division and the motor division are both working as it should. So we have you feel a couple of different modalities, such as vibration, cold, heat, a sharp prick, a pinwheel, light touch, and things like that. And then we want to check your motor division and check your deep tendon reflexes. These are very, very simple. It can be done in the office. And then to get a fair evaluation about what's going on, we want to do all that stuff, and then come up with a evaluation. Do you have a low or a mild problem? Is it moderate or is it severe? And that is going to determine what kind of care that you're ultimately going to need. So when the doctor tells you that there's nothing that can be done, really what he should be saying is that there's nothing that he can do. If you go to a primary care physician or a family doctor, they're not well trained in detection and diagnosis of peripheral neuropathy. If you go to see a neurologist, typically what they're going to do is they're going to do a needle EMG test. This is a very non-specific test, and but it's considered to be the gold standard of testing when it comes to evaluation of neuropathy. And then what they're going to do is, if your test score is below a certain threshold, he's going to say, okay, you have neuropathy. Here's your gabapentin. I'll see you again in 6 months. And the gabapentin that they give people does not fix neuropathy. What it is it's classified as a anti-seizure drug. It's there to treat epilepsy. So whether or not you get gabapentin or Neurontin or Lyrica, it's all the same thing. These are all made by Pfizer, and gabapentin and Neurontin are the exact same drug. One of them is a generic, one of them is a brand name. That's why they go by different names. And Lyrica is just extra strength Neurontin. It's like um, Tylenol versus extra strength Tylenol. They're both acetaminophen. It's just the dosage size is the difference. So anyway, um, I hope you've got a lot of value out of this. If you want to get some more information like this, please hit like, subscribe, and ring the notification bell so you're informed about when the next video is available. If you have any comments about your own neuropathy, please leave comments in the section below. I also have a free evaluation, a free assessment for people with peripheral neuropathy. It takes about 2 minutes of your time. It's completely free, and you'll have the results sent to you immediately. So you click on the link that I have below, leave your name and your email address or your phone number or both, and I will send you the results. It'll ask you a couple of questions, and then you get to determine how bad your problem is. Anyway, thank you very much for watching. I'll see you next time.